the U.S. has now reached the goal of fully vaccinating nearly 20% of its entire population. This means around 66 million Americans have been inoculated with the Pfizer, Moderna, or Johnson & Johnson vaccine. These figures from the CDC and our World in Data makes it the U.S. the fourth most vaccinated country by population, behind Israel, Chile, and Bahrain. Many countries, however, do not even expect to reach 20% inoculation. And joining us now is former FDA Commissioner Dr. Scott Gottlieb. He's a member of the Pfizer board. And why don't we start right there, Dr. Gottlieb? What do you make of the world progress on the vaccine, and how much does that play into us being able to put COVID behind us in the United States of America?
Yeah, look, there's no question that it's a challenge getting the vaccine into low and middle income countries in particular. I think that as we get into the later half of this year, there's going to be much more supply available to put into different markets. I think the problem and the challenges are still going to be the logistics. Some of these vaccines need very complex cold chain storage. And delivering them, especially in low-income countries that don't have the healthcare infrastructure, can be a challenge. COVAX is working on that. The U.S. government, the Biden administration, has given a lot of money to COVAX to support that. The companies are donating vaccine to COVAX, including the company I'm on the board of, Pfizer. So some of it's being addressed, but I think we need a much bigger initiative, something on the order of what we did under PEPFAR, to put really massive resources into making vaccine available, particularly in low and middle income countries that are going to face challenges getting access to these products. In terms of what it means for us, I don't think you're going to truly solve the challenge of COVID for the United States until you solve the challenge of COVID for the entire world, or for most of the world, particularly when you talk about our neighbors like Mexico. I think we need to be doing much more, particularly with respect to our close neighbors and Mexico in particular, to get vaccine into those parts of the world, because as long as they have outbreaks, we're going to continue to have spread here in the United States.
Hey, Doctor, so we are baseball fans here, and I couldn't help looking at replays last night from Houston and seeing packed crowds, then looking at a lot of other ballparks and seeing maybe 2,000, 3,000, 4,000 people there. Obviously, medical professionals have been recommending social distancing stay in place, but the numbers aren't matching up neatly. We're not having explosions in Texas of COVID, and we're not seeing falling numbers in some of the Northeast states. How should Americans look at this? How should they look at the different regions of the countries addressing COVID differently? And what's the best path forward?
Well, look, I think there's an improving picture overall nationally, with now 112 million people with at least one dose of the vaccine, probably about 130 million Americans who've had the infection. We have a lot of immunity in the population, and that's going to be a pretty effective backstop against renewed epidemic spread. Now, that said, there are parts of the country that are very hot right now, particularly when you look around the Great Lakes region, New York, New Jersey, where they are seeing localized outbreaks. A lot of that spread right now is in children. I think it's partly a result of the fact that we have reopened schools, and I'm not saying that was the wrong decision, but we need to recognize that as we reopen schools and as we re-expose social networks that have been largely sheltered from the virus to the risk of spread, we're seeing spread in those groups. The biggest growth in terms of new cases in Michigan is among children under the age of 19. Same thing with Massachusetts. So we need to recognize that there's parts of the country right now that are very hot, that are having outbreaks, and are not going to be easily quelled. I think we need to try to get vaccine into those markets. We should be doing more in Michigan to get more vaccine into Metro Detroit, which is the epicenter of their epidemic right now. But as the situation improves overall around the country, there's still parts of the country that are lagging, particularly the North and the Northeast. I think at least partly what's probably contributing to that is that they're not benefiting from the seasonal effect. If you look what's happening in the South right now, to your point about Texas, and even in Florida for that matter, where there's a lot of activity, mobility is way up, you're not seeing big outbreaks. That's partly probably because they've been able to move a lot of activity outdoors, whereas in the North and the Northeast, they're not getting the benefit yet of that seasonal effect, but they're going to start to get that benefit. So I think things are going to continue to improve overall around the country as we vaccinate more people, but there will be some parts of the country that are going to lag, and there will be some parts of the country that I think might need to tap the brakes a little bit.
Dr. Gottlieb, it's Willie Geist. Good to see you this morning. We've heard from Dr. Walensky, the head of the CDC, and also from Dr. Fauci, sort of this balancing act of, yes, we've made incredible strides in getting the vaccine distributed, getting it out to the people who need it faster than had been scheduled, but also let's not jump ahead. We're not out of the woods just yet. You said the other day that a fourth wave is not likely. So what gives you that confidence when we're hearing a little bit more reservation, a little bit more hesitation from the people at the top of those organizations?
Yeah, look, what gives me that confidence is that we're not seeing evidence that there's reinfections taking place on any wide-scale basis. So people who are either vaccinated or who have had the infection do appear to have immunity that's durable, and they're not getting reinfected, at least not becoming symptomatic. I think at this point we'd probably be detecting it if it was happening on a widespread basis. So with 110 million people partially vaccinated, 130 million people who've been infected at least, when you start to add the numbers, you have a percentage of the population where at least 60% has some form of protective immunity, maybe more than that. You're not quite at herd immunity, but you're at levels where this just isn't going to transfer as readily. So I think the next 2 or 3 weeks are going to be challenging, and that we're probably likely to see a plateauing in cases. We might see a continued uptick in the parts of the country that are still experiencing epidemics, like Michigan, like Massachusetts, like New York. But for the rest of the country, I think it's going to be a continued overall improving picture. And it's going to be hard to reimpose restrictions on the population. Right now, people who are worried about COVID want to go out because they've been vaccinated, and people who aren't vaccinated want to go out because they were never worried about COVID. I think as you get into end of April, May, when the vaccine's widely available, everyone who wants to be vaccinated and who wants to protect themselves will have that opportunity. So you're going to have a lot of people who feel that they, are at lower risk, and they are at lower risk. Right now, if you look at the case fatality rate around the country, and it's hard to measure because deaths are always a lagging indicator. The deaths that you're seeing today were the result of infections that happened more than a month ago. But even if you just look at the crude case fatality rate or the infection fatality rate, it's about 0.4% if you assume that we're diagnosing 1 in 3 infections. If you assume we're diagnosing 1 in 4 infections, which may be the case, the infection fatality rate is probably around 0.2%. So what that means is the overall vulnerability of the American population has been substantially reduced by a function of the fact that medical care has improved, and also a lot of the most vulnerable Americans are now protected.
There was some thrilling news for parents and kids last week.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.